This section will look at how to use the computer during the consultation and how this can be achieved without affecting your communication with the patient. The computer can also be used to help the patient learn about their condition and to understand your planned management. There are two important points here. First, the GP is sitting with an open posture. Second, the screen, the GP and the patient form an equilateral triangle. It is not difficult to use the computer whilst still sitting back in your chair. You do not need to crouch over the keyboard, but you may need to get extension leads, either for the keyboard and mouse or for the screen. It is very difficult, perhaps impossible, to attend to more than one grammar at any one time. This means that if the patient is talking to the doctor while the GP is reading information from the computer screen, it is possible that anything the patient says will be misinterpreted, if heard at all. This is particularly true if the doctor has to concentrate in order to use the system properly, or if the doctor is presented with information that is new to them. It helps if you are familiar with using your clinical computer system and familiar with the content that may be displayed on the screen. However, in any event, it is important to control the process of the consultation so that the patient is quiet while you're reading off the screen. This way, you can avoid communication problems. There are several ways to do this. Firstly, signposting. Say to the patient, for example, "Excuse me while I concentrate on the screen for a moment." Secondly, use body language. That is, make a pronounced movement which indicates that your attention is shifting to the screen. Thirdly, give a running commentary on what you are doing. If you fill the space, it's harder for the patient to break in. If the patient does start talking, it's probably best to abandon the task on the computer, listen to them, then break off again. When you have finished the task on the computer, you should do the reciprocal signposting or body movement to indicate that your attention is back with the patient. This consultation is with a man who has had earache for 24 hours. The GP has examined him and diagnosed otitis media. She doesn't think that an antibiotic prescription is appropriate.
Well, I've had a look in your ear and you do have a middle ear infection. This sort of infection normally clears up by itself in a few days and doesn't really require a prescription from me.
Well, I thought you needed antibiotics for things like ear infections.
A lot of people think that, but in actual fact, they're of very little value at all. What you actually do need is something to take the pain away. I'll print an information leaflet for you to explain this further. Can you just give me a few minutes to enter the details into the computer?
The advantage of having the screen near to the patient is that the doctor can glance from the screen to the patient without any body movement. The doctor has used words to tell the patient what she was doing. This is called signposting. This is the same patient that we saw in the previous consultation. This time, the screen is at the opposite end of the desk from the patient. With this setup, it's a lot easier for the patient to read what is on the screen. On the other hand, the patient is out of the doctor's field of vision when she is looking at the screen.
When I looked in your ear, I could see that you did have a middle ear infection. Now, this sort of infection normally clears up within a few days by itself, without a prescription of an antibiotic from me.
I thought you would always need antibiotics in things like this.
Lots of people do, but in fact they're of very little benefit. However, what you do need is something to take away the pain. You seem a little bit uncertain. Should we get some more information about this from the computer?
Yeah, okay.
Can you see that?
Do you think this is right?
Yes, I do. We used to normally give antibiotics for middle ear infections, but studies from other countries have shown that really they're of very little value. And so now in this country we tend not to prescribe antibiotics as well.
Okay. Okay, then I'll try the painkillers and see how it goes.
The Prodigy Shared Advice Screen for first-line treatment of acute otitis media is displayed for you now. This shared advice screen is written with the expectation that the patient will take part in the decision about which treatment to take. In this consultation, the doctor used a mixture of verbal and non-verbal techniques to maintain rapport with the patient while she used the computer. This consultation is with a patient who came in complaining of itchy eyes. The doctor has examined the patient and diagnosed allergic conjunctivitis. She has decided to use Prodigy to issue the prescription. To do this, she has to type in the read code or synonym for allergic conjunctivitis and then follow instructions on the screen. Once this has been done, the prescription prints out and the doctor's record keeping is complete. The consultation is finished. In the long run, this saves time, but it does mean that the doctor has to concentrate on the computer while the patient is still in the consulting room.
Yes, your eyes do look sore, and I think the problem is some sort of allergy.
That's what I thought.
I'll give you a prescription for some drops that should help you feel better. Can you bear with me for a few minutes while I enter the details into the computer?
Have you any idea what actually might have caused it?
No, I don't. It can often be things like plant pollen or animal fur. Have you come across anything like that recently that could cause it?
Not that I can think of, no.
No, it's often a mystery, but if it keeps happening recurrently, you can sometimes spot a pattern. I'll just finish doing the prescription. What I suggest you do is to put one drop in each eye 4 times a day. If you take this along to the chemist, and your eyes I'm sure will feel better in just a few days.
Thank you very much.
In this consultation, the patient started talking to the doctor while she was working at the computer. Sometimes these interruptions can be important. When the doctor is quiet, it's a chance to come out with something. The other time that patients do this is on the way to the door at the end of the consultation. Our doctor stopped what she was doing and gave her full attention to the patient. She was able to go back to the computer task soon afterwards. In each of these simulated consultations, we have seen the GP use communication skills to maintain rapport with the patient, while also using the computer. There are many different ways of doing this, and more suggestions can be found on the Prodigy website. Details can be found in the further information segment of this CD-ROM. The 3 consultations that we have shown each used a different room layout, and they illustrated the advantages and disadvantages of each of the commonly found setups. In most consulting rooms, the scope for moving the furniture around is quite limited. You may not be able to put the screen in what you think is the ideal position. Consider whether you want the patient to be able to read what you're putting on the screen. There is no one right setup, but it is important that you know about the effect that your room layout has on the consultation. The GPs we have seen all knew what information the computer was going to offer. Sometimes the computer will provide the GP with new information during the consultation. Sometimes this comes as a surprise. We will look at GPs coping with new information in Section 5.